Welcome everyone. This is Vineet Yejila. I'm one of the co-founders and CEO at KPI Ninja. I would like to thank WISHIN for this opportunity to give you a quick background about KPI Ninja as well as share details around our collaboration with WISHIN in deploying our Ninja Universe platform to support the future WISHIN Pulse in partnership with Veltrua. As Veltrua shared earlier today, we are extremely excited about the different possibilities and opportunities that exist to leverage our infrastructure together and support various use cases that would directly benefit WISHIN and its participating organizations. Before we jump into the details, we would like to take a few minutes to give you a quick introduction about KPI. KPI Ninja is one of the fastest growing healthcare technology companies primarily focused on interoperability, enterprise analytics, and population health management solutions. Our mission is to partner with organizations like WISHIN and improve the health of the communities in the entire region. We are extremely passionate about improving health outcomes. We do not see ourselves as another organization just moving data or building dashboards, but rather a catalyst for healthcare improvement by providing the right information to the end users solving complex interoperability challenges. We have a strong presence across the country supporting over 22 million lives, working with more than 5 HIEs and several HIE partners. We also work with several accountable care organizations, clinically integrated networks, payers, and other risk-bearing organizations across the country as well. We have a strong team of about 12 to 15 associates that are directly involved in this project during the implementation phase. Our core team includes senior leadership team as well as a good representation from both the technical and population health teams. KPI has partnered with WISHIN close to a year ago in supporting Wisconsin Department of Public Health in the build of COVID rosters. For this project, we were able to build the technical infrastructure to support the ingestion of CCD documents or continuity of care documents, parse them, and combine this data with existing HL7V2 data before we built the logic to support the COVID rosters. And we were able to build this infrastructure in less than 2 weeks, which demonstrates our agility and our experience in solving interoperability problems and delivering customized solutions to support various use cases like these. Now, we have started to use this existing infrastructure to support several other use cases, including supporting payers around HEDIS and care management activities, as well as other initiatives as we see fit. Our core platform that we'll be deploying with WISHIN is called Ninja Universe. Ninja Universe is a one-stop solution with more than 25 applications that are designed to support several use cases, including community health record, population health management, care management, and more. Being data source agnostic, we can ingest data coming in from both structured as well as unstructured data. We typically ingest clinical data coming in from electronic health records and health information exchanges. And we do have quite a bit of experience handling claims and supporting different use cases based upon the claims data as well. We also ingest social determinants of health, virtual communication to support several use cases as well. From a data ingestion standpoint, we do bring in HL7V2 data, CCDs, and also our platform is FHIR enabled, and we do support several database and API integrations with EMRs as well. The integrations engine that supports our core interoperability and the analytics layer, as well as the business intelligence modules, all of these have been internally developed, which gives us the flexibility to support any customizations and also help us to be nimble and support emerging use cases, just like the role we have played in supporting WISHIN for the COVID rosters use case. From a predictive and prescriptive analytics standpoint, we have a combination of several internally developed machine learning algorithms And also we do tap into Johns Hopkins ACG risk stratification models that has been embedded as part of Ninja Universe to support organizations in their population health journey. We do have over 350 clinical markers that support numerous use cases through these different models. With an estimated volume of 80% of the data residing in unstructured format, it is very important that we do tap into this wealth of information that is available out there. With our natural language processing engine, we do have several use cases that has been built over a period of time to support providers and payers around different initiatives to maximize the value out of it. Our Ninja Universe is certified by NCQA around ECQMs or Electronic Clinical Quality Measures, the HEDIS program, the Patient-Centered Medical Home program, as well as Patient-Centered Specialty Practice. In fact, we are the only technology company that holds all of these certifications, which demonstrates our commitment in adhering to these national standards, as well as our alignment with the direction where value-based programs are evolving. There are several different initiatives like HEDIS, ACO measures, MIPS, CPC+, PCMH, and more that can straight away benefit through our certification process within Ninja Universe. For 2020, KPI Ninja was also a beta testing vendor for NCQA around the ECQM certification process. Again, demonstrating our commitment in being a leader in supporting population health initiatives. Apart from this, Ninja Universe is ONC certified health IT product as well. We have an aggressive roadmap that we are going after to achieve few other certifications throughout this year and are excited to leverage these capabilities with WISHIN and the participating organizations. As Rick and Melissa from Valtura have shared, we are very thrilled to come together and support WISHIN with our community health record solution. Within our Ninja Universe solution, we'll be deploying our Patient Comprehend application, which supports the community health record use case through the support of Valtura's backend capabilities. The application itself is very intuitive, user-friendly, and can be easily customized to support use cases that go beyond the longitudinal patient record information display alone. And with our background in enterprise analytics, Patient Comprehend also has functionalities where we can display graphical summary of some of the lifestyle management metrics like blood pressure, HDL, LDL, triglycerides, and so on at the patient level. And the best part about this entire Patient Comprehend solution is the ability to connect the community health record to the applications like population health and care management, which overall enhances the user experience and seamless integration between the applications and brings the efficiency within the care teams. And without any further delay, we are very excited to give you a quick preview of our Patient Comprehend solution.
Ninja Universe is one of the industry's most flexible, scalable, and interoperable solutions designed to connect disparate data sources within the ecosystem and enable applications to improve patient care. We are excited to give you a quick glimpse into our Ninja Universe platform, focusing on the community health record solution for the future WISHIN Pulse. As we do a quick demonstration of the platform, we would like to emphasize that this is a demo environment, and the live environment as we deploy is going to be aligned with WISHIN's needs. We expect the customizations are going to be far superior to what we are demonstrating today. With that, we can jump into demoing our core platform, Ninja Universe. Ninja Universe is a web-based application, and as we log in, based on the user's access, a list of applications is displayed in the home page. Ninja Universe supports several different use cases, including enterprise analytics, population health analytics, and care management solutions. In the current state with WISHIN, we are focused on deploying the Patient Comprehend solution to support the community health record use case. This is the application of focus for this demonstration. Patient Comprehend aggregates and normalizes the data, regardless of the data source, and provides a unified patient record in near real time. As an example, we are going to take a test patient, Jane Doe, and walk you through the different capabilities that might be available from an end user standpoint to support the different use cases. There are a couple of ways to view a patient record: logging into the browser and searching for the patient, or through single sign-on capabilities where you can access the patient's record right from the EMR with one-click access for seamless interaction. The Clinical Summary tab is designed for the longitudinal representation of care on one screen and provides a summary of demographics, patient visit history, diagnosis, allergies, procedures, medications, labs, radiology, CCDA documents, and more. Where applicable, the user can drill down further to get more details. In this case, as we select the most recent encounter for Jane Doe, we can see the encounter summary of the patient with specific diagnosis, labs, medications, and procedures. The user also has the ability to search for specific results. As an example, as we search for diabetes in the problem section, we can quickly determine if the patient has any history of diabetes. We can view other items such as labs, imaging, and documents in this section. Different vitals and procedures are displayed here as well. Within the clinical viewer, users also have the ability to export the community CCDA, which aggregate the data across all of the data sharing organizations. Please note that we are working with WISHIN to customize the specific information that needs to be displayed here, and the final view might differ based on the configurations we are currently making. The timeline view is designed to provide a graphical representation of some of the key data to enhance the decision-making process. Here, we can see a quick visualization of the different encounters patient Jane Doe has had over the last few years. You can imagine how this is going to quickly provide insights on the interactions Jane Doe had with the healthcare organization sharing data with the HIE. Labs also have spark lines, or trend lines, where we can see how they are progressing over a period of time for this patient. We can trend specific lifestyle metrics like HDL, LDL, triglycerides, and blood pressure values for this patient to help clinicians, providers, and users interpret this key data easily. KPI Ninja is known for our agility and innovation to support various use cases in improving patient care. During the early outbreak of COVID-19 last year, we developed a view to support providers, payers, public health, and other users to quickly extract the key information relevant to COVID. As an example, for Jane Doe, we can easily access the labs relevant to COVID, any hospitalizations, medications, and recent diagnosis. As it is important to understand the underlying chronic conditions for the patients, we started tracking nearly 35 chronic conditions and flagged them to the end users for easier understanding of the potential risk for this patient. We've also designed a timeline to provide a quick glimpse into different interactions the patients had with healthcare entities once a positive lab had been diagnosed. We wanted to demonstrate our ability to design templates like these for any future use cases to support WISHIN and its participating organizations beyond the community health record. As an example, one of the discussions we are currently having with WISHIN is the ability to track vaccinations. Within the Patient Comprehend, users will also have the ability to access the ePDMP and immunizations for the portal. Ninja Universe through Valitura has plans to connect to eHealth Exchange, which is the largest healthcare information network in the country. Apart from the ability to download and print, the users also have the option to pin or favorite a patient. Once the patient has been pinned, this patient is added to the user's My Patients tab. Within the My Patients tab, the user can see a list of all the patients that have been pinned in the past. From a care management standpoint, this helps the users to quickly track specific patients, their recent encounter history, as well as some key relevant information in one place. On this screen, apart from the key demographic information, we are also displaying the last ED, inpatient, and outpatient visits for the patient, as well as the total count of these visits. We are also tracking the total number of chronic conditions for these patients. Users can easily sort information to provide their patients with recent visit information and easily download this report into Excel or CSV format. The user also can select specific timeframes to view specific information displayed on the dashboard by selecting the parameters available in the filters. And lastly, you can unpin a patient to remove them from the list. With these different attributes, you can quickly see the My Patients tab with the functionality to pin patients and track specific encounter information would help in supporting various use cases. Patient Comprehend also supports advanced FHIR capabilities with mapping of clinical data to US CDI standards and claims data to CAREN implementation guide specifications. To conclude, Patient Comprehend is one of the most comprehensive solutions to support the longitudinal patient record use case to facilitate timely communication between providers, clinicians, payers, public health, and beyond, with a goal to improve patient care within the community.
We hope you liked our quick demonstration of our community health record solution. While our focus is going to be in deploying Patient Comprehend solution to support the current state for the next 5 to 6 months with WISHIN, we also wanted to paint a picture on what our vision is for the future of HIEs and how we support our vision. Working with several HIEs across the country, we are seeing a fundamental shift that is happening in the health information exchanges space. A transition from being a transactional intermediary to a population health enabler. With a continued shift from volume to value-based care, HIEs have been the center of this change, supporting healthcare organizations around several use cases well aligned with the initiatives proposed by CMS, ONC, and NCQA. Some of the trends that we are currently seeing and that are shaping HIEs include renewed focus on public health. With the COVID-19 pandemic, we are seeing stronger relationships between HIEs and public health initiatives. There are numerous stories where HIEs have played a key role in supporting public health data needs. This trend will likely extend to other disease surveillance opportunities and ultimately build an infrastructure that is proactive in nature. And moving beyond clinical data is another theme that we are seeing with a lot of other HIEs as well. Traditionally, health information exchanges or HIEs have primarily focused on clinical data. However, this is changing over the last several years. Now, an increasing number of HIEs share data around claims, prescription drug monitoring programs or PDMPs, social determinants of health, and public data sets. Combining all of this data and bringing it to the patient level is invaluable for participating organizations, who can then leverage this information to make more informed decisions. And also, we see a huge alignment with the value-based programs, and we are seeing a lot of the healthcare organizations increasingly depend on the HIEs across the country to support the data and analytics needs of several value-based programs. And to give you some examples, organizations participating in bundle payment programs are looking to receive ADT information or admissions, discharges, transfers information around any post-acute care activity. Payers are relying upon the HIEs to support with their HEDIS program, quality initiatives, and care management activities. Accountable care organizations and clinically integrated networks are tapping into the HIEs to support them with their analytics and population health needs. And there are several other use cases and examples like these where HIEs are playing a key role in supporting their participating organizations. KPI Ninja, we do firmly believe that this transition of and shift, from being a transactional intermediary to a population health enabler is going to be a key change that the HIEs are going to go through to provide more value back to their participating organizations and truly become a population health enabler in their communities. As Weltra shared about the benefits of this combined infrastructure, we believe we could leverage this to support several initiatives helping WISHIN transition to be a population health solution for the state of Wisconsin and beyond. And some of the examples in the future state include providing dashboards, reports, care gaps, and other resources to support providers in several quality improvement activities, and supporting accountable care organizations and clinically integrated networks in building the necessary data and analytics infrastructure, or even share relevant data in supporting the care teams better manage the populations, and supporting payers with HEDIS programs through ECQM or electronic clinical quality measures initiatives, or emerging programs like data aggregator validation program through NCQA to reduce the overall burden in primary source verification process and improve the overall HEDIS performance, are some of the examples and use cases that we could leverage using this existing infrastructure in the future state. There are several use cases beyond this, and we really cannot wait to move into the future state once we deploy the community health record in supporting WISHIN's participating organizations around these different initiatives and enhance the value that is being delivered through this infrastructure. With Ninja Universe, our analytics and population health capabilities go beyond disease management and risk stratification. We also can support organizations with performance analysis, both at the provider and program level. We also have the capabilities to support around financial analysis of a program and even have experience with capitation models. With built-in Johns Hopkins ACG model within Ninja Universe, we have over 15 different risk models that we do tap into based upon the different use cases and the populations we are dealing with. We have several concurrent cost models, also known as retrospective models, which help us assess the risk factors derived from the same time frame as the outcome variable. We also have prospective cost models where the risk factors are derived from previous period to help predict specific outcomes in the future. Ninja Universe can also model outcomes that predict or explain the annual medical or pharmacy cost and help us to predict the likelihood of certain sentinel events like probability of inpatient hospitalization or probability of ICU admission or probability of a patient getting readmitted. Ninja Universe also has over 350 clinical markers to proactively support care teams that are managing the patients. An example of a clinical marker is patients who are actively taking diabetes medication but do not have a diagnosis of diabetes. As you can see, having this type of data could be potentially helpful for the care teams to close any care gaps as well as improve the risk score for this patient. And these markers are distributed across diagnosis, pharmacy, labs, utilization, and coordination. You can imagine how we can leverage the data within the HIE and also the infrastructure that we are co-creating to support these several use cases and help organizations better manage the populations through this infrastructure. In summary, what we are seeing the role HIEs are playing to support our value-based care space and population health initiatives, it's quite amazing. What we have seen HIEs a decade ago is not the same as what we are seeing today. and will certainly not be the same in 5 to 7 years from now. The value creation and alignment are expanding exponentially and are very much aligned with the needs of the stakeholders. At a high level, we have categorized this into 4 different buckets, as you can see in this diagram, moving from reactive to proactive. We are seeing different initiatives where HIs are being tapped into in supporting the manual extraction process and automating these processes through initiatives like ECQMs, where HIs are tapping into organizations like KPI, who is ECQM certified and who can build these measure logics, and also who are HEDIS certified and support payers or providers to reduce the manual efforts in gathering this information or even calculating these measures based upon the measure specifications. We are also seeing how HIs are supporting the tracking of several performance initiatives. Whether you're tracking and managing chronic conditions or managing populations based upon their utilization patterns, HIs are providing that support to different stakeholders around these different initiatives. And HIs are already supporting their participating organizations with several population health initiatives like ADT notifications and disease management for care management activities, and already are moving into the direction of building social determinants of health infrastructure as well. And finally, what I love about the HIs is their ability to support and move into the direction of individualized medicine. There is a huge opportunity in this space where HIs can tap into these big data sets to build meaningful machine learning models and support care teams proactively better manage the care for their patients. As you can see, with the infrastructure that we are creating with Valitura to support WISHIN, we believe the future potential for Wisconsin is massive and is super exciting. We would like to spend some time to give you a quick glimpse of our population health initiatives and solutions within Ninja Universe. As we demonstrate our pop health solutions, we wanted to emphasize that deploying patient comprehend is our current focus for WISHIN, and as the use cases emerge, we'll be working with WISHIN to unlock the applications for population health in the future state. Our hope is to give you a picture of what is possible with the platform and the infrastructure that we are creating, both in the current state as well as in the future state.
KPI Ninja's powerful suite of applications sits on top of the HIE infrastructure, bringing data from varied sources, including claims, clinical, medications, and social determinants of health, to support diverse analytics, population health, and care management initiatives. We wanted to give you a quick glimpse into our platform by demoing a few of these applications. First, let's look at population health. Our population health app is designed to summarize the performance of measures across several different initiatives like HEDIS, MIPS, CPC+, bundled payment programs, patient-centered medical home, ACO, and others. With Ninja Universe being ECQM, or Electronic Clinical Quality Measures certified by NCQA, we maintain the updated logic by NCQA on a year-to-year basis to support these different initiatives. We can locate the gap report for each of these measures to view key demographic information as well as recent encounter information and care gaps. We can also see the patient-level summary where we can export the entire CCDA or view the detailed information like care gaps, diagnosis, risk, vitals, and more. Ninja Universe, also being HEDIS certified, can ingest claims data to support payers, ACOs, clinically integrated networks, and support with HEDIS measures calculation as well. Next, let's check out the Health Intelligence app. The utilization summary provides a quick snapshot of the key utilization measures as well as any hospitalization-specific measures. With KPI Ninja's internal machine learning algorithms, coupled with built-in Johns Hopkins ACG risk stratification models, we have the ability to predict any potential hospitalizations, ICU admissions, as well as 30-day readmissions. We also utilize several proven models like NYU ED algorithm to classify ED visits and identify patients that can be treated in a primary care setting versus who needed ED care. In the care management dashboard, patients with specific diseases can be tracked. Within a given population, based on age band and morbidity conditions, patients are distributed from a range of healthy users to high and very high-risk populations. As these are drillable at the patient level, the care teams can focus on these patients to improve the outcomes proactively. The system can also predict the total cost for both medical and pharmacy data. Ninja Universe has more than 15 different risk stratification models based on patients' demographics, clinical data, claims, and medications data to help better manage the patients within a population. Apart from dealing with structured data, Ninja Universe can also tackle unstructured data from PDFs and free text. As an example, we will take a sample text from one of the documents and demonstrate how the unstructured data is converted into discrete data. The text that we have analyzed resulted in the extraction of 27 different variables. Beneath each variable, we can see the probability as well. This allows us to determine what factor we are comfortable with as we ingest this unstructured data. As you can see, we can filter these based on medical conditions, medications, procedures, and more. This view is for demonstration purposes, as the natural language processing engine that we have in the backend supports several use cases supporting providers and payers across multiple initiatives. Next up, HIE 360. HIE 360 supports several use cases like disease management, readmissions, chronic conditions, and utilization management on top of the HIE data. We would like to demonstrate the content, functionality, and ease of use within the application. Ninja Universe tracks over 35 chronic conditions, and you can see their distribution and prevalence for a population that is being managed here. We can also identify any opportunities within a specific disease like diabetes around medication adherence or even coding opportunities, and can drill down to the patient level with one click. With the readmissions dashboard, based on the HIE data, the organizations can track any readmissions for their attributed populations in real time, regardless of where they are admitted, as long as they are contributing to the HIE. This is a quick example of the ED utilization dashboard tracking high utilizers. We can easily drill down to patient-level details within the dashboard. We also have an option to filter specific parameters for the dashboard to be updated in real time. The dashboard is easily configurable to include additional metrics or views based on user preference. The patient-level report can be drilled down further to gain more insights. The cohort utilization provides a quick summary of ED, inpatient, and outpatient visits for an attributed population. And finally, let's look at care management. Ninja Universe has a fully integrated care management platform to support the care workflows, chronic care management, transitional care management, or gaps in care. We would like to quickly review our worklist solution that helps to close any gaps in care. During the onboarding process, KPI Ninja works with organizations to identify all of the rules that are needed. A rule is defined as a logic that triggers a cohort of patients that we would like to see in the worklist. For example, if we would like to track any patients with more than 5 ED visits in the last 60 days, we would write a rule to support this logic, and when the user subscribes to this specific rule, the patients who qualify for this rule show up here. Viewing the work list, we can see a list of patients who qualify for all the rules that the user has subscribed to. Here, we have the ability to export, sort, flag, as well as document any content relevant to the specific rule for each patient. As you can see, having an app which proactively triggers a list of patients that supports the rules that the organization would want to focus on helps immensely in closing any care gaps, which in turn improves the overall outcome of the patients. With this, we would like to conclude the demonstration showcasing a few apps within Ninja Universe that supports WISHIN's future use cases in supporting the participating organizations around the population health journey.
We hope this quick demonstration gave you a taste of our population health solutions and capabilities in general. As we have limited time, we focused on few applications and would love to share more details as we move beyond the deployment of the community health record solution over the next few months. To conclude, bringing in diverse data sets from different organizations was one of the primary use cases for the HIEs in the past. How we leverage this existing infrastructure and the ecosystem and align in the direction where CMS, ONC, and NCQ are heading to support the participating organizations is the new future. This requires a transition that the HIEs need to shift from being a transactional intermediary to a population health enabler. We are very excited to be part of this journey with WISHIN and to support WISHIN be the population health enabler within the community, and are very much looking forward to this journey in partnership with Valentura. Thank you again, and here is my contact information if you would like to reach out. Thank you.